The Director of Health Services Government of Meghalaya, Dr. Aman had spoken exclusively to Media Plus on the 13th of July 2021 on the ongoing pandemic and the mutation effects of the virus on human beings.
Speaking on the current pandemic situation, Dr. Aman stated that the positivity rate in the entire state has come down except for 2 districts of which the rate is above 10%. Dr. Wah added that the infection rate is also showing a plateauing decline, which is good news for the state.
As of today, the positivity rate, what we have seen is that it's coming down. Only in the 2 districts, that is East Khasi Hills and West Jaintia Hills, it's just showing just above 10%. Otherwise, other districts is coming down. So it's a good sign for us, and I think what the measures being taken by the state government is taking effect, and we hope that with the cooperation of all the citizens of the state, we'll be able to bring down this positivity rate, and with the strict following of all the protocols, we'll be able to contain this particular disease. Yeah.
On the anticipation of the third wave of COVID-19, the Director of Health Services, Dr. Aman said that currently the ongoing pandemic is in its second wave and the state is yet to recover from its effects. However, along with the entire country, Meghalaya is also prepared to tackle the third wave through infrastructure and training of health workers, which is being put in place at various corona care centers across the state, so that even when there is a surge, the general populace would not be hurt by its effects.
See, what happened is that we are not yet over with this current surge. Okay, it's just that the cases which we are seeing now, the graph, as per the graph, it's plateauing. It's just a plateau. Now we expect that with the coming forward of people for vaccination, even if there's another surge, that apprehension or that worry which we had before we got this vaccine, I think to a large extent that will negate the effects of any other surge which comes along. If you say that the determinants of the transmissibility of the virus, so we are seeing how this virus is evolving. Now last year, as you could see, I think one of my colleagues also had already expressed this. If there is a positive case in one particular household, the rest of the people in the house do not contract the virus. But in this situation now, we have seen that if there's a positive case in one particular household, the rest of the household also, they contract the virus. So it appears that the virus also is a question of survival. So it evolves itself and tries to modify genetically in such a way that it can infect and it can affect the host. And here the host of this virus, the main host of the virus where we have seen the affection is human beings. Yeah, and that is what it's. No, see, this is a situation which is still a pandemic. The virus is still the same. It is a COVID-19 virus in different forms. Now, we have learned the hard way along the way. We are ramping up all our institutions, not only in the sense of infrastructure, but we are ramping up in the training programs which we are imparting to all concerned, right from the doctors down to the ASHA level. And if such a time comes when we expect that there will be a sudden surge, our preparation now is to prevent that even if it comes, it will not affect or it will not hard hit the populace of the state. And that is why we have been advocating, and I will say it again, get yourself vaccinated. We have seen in the hospitals, I have said this time and again, the people who contracted the virus, the vaccinated vis-a-vis the unvaccinated. The difference is very wide. And I've said that it was very painful. In fact, most of our doctors and nurses were on the verge of tears when they found that the course of the disease that the virus takes, the unvaccinated, they reach to a point where there is nothing that can be done. While for the vaccinated, the course of the disease is very different, and they come out well with only symptomatic treatment. Yeah.
When asked about the effects of the third wave on children, Dr. Wah stated that the virus can only be transmitted from infected adults to children, though they have their own protective mechanism against it. Therefore, Dr. Wah urged upon citizens of the state to get themselves vaccinated so as to save the children from being infected by the COVID-19 virus. The message that the Director of Health Services, Dr. Aman wanted to convey to the general public is that each eligible citizen of the state should come forward to get themselves vaccinated against the virus so that even when the virus is virulent, its effects would be negligible.
The message is very clear. If there is an apprehension that the way that the virus is evolving, if it affects the children, this virus will be passed on to the children only from the people who contract this virus and where this virus becomes virulent in them. Now, for the people who have been vaccinated, that virus cannot become virulent. Even if it passes on to their children, that virus will not be virulent in the children. However, if the virus affects the unvaccinated and it passes to the children, then that virus will be virulent as it has been to the parents. As of now, the children have got their own protective mechanism. That is why many of them who have been infected also, they have come out of it. But a time will come when that virus will evolve. And how will it spread to the children? The children are not going out. They are not going out into open space. We are restricting that one. Schools also have been restricted. It will come only from adults. So now the question is, save our children, get yourself vaccinated. Because when it is too late, our job as doctors, what do? We will treat. If we cannot help, then for us, it becomes a helpless station. Don't allow that station to come. Don't allow that station to happen. That is the appeal to all.